Let the jaw relax. There you go. Very nice. Oh, yeah. Wow, it's moving finally. Yeah. This never happened last time. This top guy a little bit relaxed. There you go. That was loud. The sleeper has awakened. I am the prince of all sands once again. What in the world? Feeling much better. Thanks to you, I'm back in the gym. I've been working out. Look at those quads.
I know.
Man,
My
I'm
legs.
jealous. I gotta start.
My legs are back how they used to be.
Do that again.
I gotta start working my quads again. Okay.
So I went from like 175 which I was here last time to 190 because the pain is much more local.
Okay.
So I'm able to use my arms and bench pressing, pulling. That weakness is gone.
Good.
And I think my bicep curl is almost the same weight on both hands. So I think having it localized is a good sign, right?
Yes, you want it's going to rewind. It's almost like a DVD or
Yeah.
actually VHS, but nobody knows what I'm talking about. But it's going to rewind. You're going to see all the scenes that you saw getting here is how we're going to go back.
Yeah.
You notice the chest is also getting tight. You know,
Yeah, chest is getting tight because I'm doing much more bench pressing. I am stretching it. I use a lacrosse ball to get some trigger points, just to open up like the brachial plexus. Because I feel like that helps. But I feel like since the pain is more local now, my brain is more aware of the pain in the neck because it's not going down the arm. Because I feel like it's only firing here now, so it feels like it's more painful. But it's not.
We call it centralize. It's going to centralize as we go back. See, the original injuries were all in the neck, and then as they grew, it involved the nerve that then goes down your arm. And so as the nerve starts to calm down, more local pain is just the joints. So is it right?
Yeah, like honestly, if I put my 2 fingers here and I push this area around, I get an electric shock.
Yeah.
Literally.
Those are the
Like
joints.
that.
Yeah, those are the joints that are in there that are just inflamed. And part of that is posture, like we talked about. A lot of it can be reduced as we get your upper neck working, the atlas working. And then I know you were traveling a little bit and we get back on the stretches a little bit.
I didn't have my pillow, I didn't have my bed. So I stopped using the dental roll.
Okay.
And so I was scared to use it if I'm not in the right alignment.
Have you cross this arm under? All right, here we go. Deep breath in for me. Head back. Good, deep breath in. Here we go. Let all the air out. Let the jaw relax. There you go. Very nice. Oh, yeah. Deep breath. Let it go. Very good. There you go. Very nice.
Oh my God.
Oh yeah.
Wow, it's moving finally.
Yeah.
This never happened last time. Because I know that area was stuck and now it's popping. So
He's waking up the sleeper. You on your side. Turn your head this way a little bit for me. There we go. That'll sort of hold you. Breathe in deep for me. Exhale, twist. There we go. There you go, already moving. Good, other side for me, beautiful. And take a deep breath in. Exhale, twist. You're already moving. It's already. Yeah, beautiful. Face up. Beautiful. Wow.
that's correct.
So it's one thing for it to move, and then it's another thing for it to move with no resistance. Does that make sense?
Mm-hmm.
Someone might ask me, well, aren't you happy that it moved? And it's like, well, not necessarily, because it required a lot of work and a lot of pressure to get it moved. They should be effortless in their motion. All right, you see how we're moving up here. I got you. Just this top guy a little bit. Let's try to get this atlas. Come on. There you go. Very nice. Very nice. There we go. This top guy a little bit relaxed. There you go.
That was loud.
Did good.
My brain is like
Give
still
us that-
vibrating on
Oh,
that
yeah.
side.
I've seen motion x-rays of the neck when it's been adjusted, and actually the bones actually sit there. After you've adjusted them, they go.
Yeah.
They actually like sit there and oscillate like a tuning fork. And so, especially there's one technique called the atlas orthogonal. They use like a device that just hits the atlas and you can see it kind of oscillate afterwards. And the main goal is to loosen. The knuckle has almost like a half pipe that it kind of rolls around in, and we want that groove that the joint moves in to be as svelte and smooth as possible, so that the lower neck is the last to show up. And that pain that you're describing, Ed, I just touch it and I feel electricity, just as an welcome. It's probably the most common thing in America, where C5, 6, and 7 are overstressed, and no one really has any idea other than just to numb it down, inject it, operate on it. Let's get the upper neck working. Let's get the curve back in your neck. Let's slow the aging. There's no way to stop aging, right? But we can have your spine age evenly, and we don't want accelerated aging. Cellular stress causes accelerated aging, and that's the problem that we're running into. That there really isn't any health care. What do we do? How do I keep my system regular? How do I keep my lungs clean? Your lymphatics, for instance, drain the dead tissue out of your lungs. So if the chest is stiff, the lymphatics, which drain the dead tissue, isn't flowing. So now you have all this kind of dead tissue residing in your lungs that then can be...
When you say chest, is that the thoracic?
Thoracic cage, yeah. You're just the mobility of your chest. So the adjustment that we did earlier is conducive for pumping the lymphatics, not just for the health of your lower neck. So if the chest is stiff, then your lower neck overworks, but also if the chest is stiff, the lymphatics don't drain properly. Now you have all this kind of dead tissue remaining in your lungs that becomes, able to be, for bacteria to find and have an infection. Does that make sense? So it's like leaving cookie crumbs on your countertop. You're just asking for bugs to come in and find it and pose an infection. So I'm the guy with the brilliant idea, let's just clean the kitchen. If we clean the kitchen, there won't be bugs roaming around. I think a lot of doctors want to just spray the bugs. And I go, if you just spray the bugs but leave the mess in the kitchen, the bugs will just be back. I don't see how that's a long-term solution for the problem of the kitchen should be just clean and there won't be bugs.
Yeah, man, you nailed that one. It's true, man. It's just like we need to see the root cause.
Yeah, the health of your spine isn't, yes, I'm glad people come in for spinal issues and we fix the back pain, but your spinal health is your health, the health of your heart, the health of I had a lady with gastric paresis and she has all this inflammation up her back, and as we were adjusting her stomach is starting to function. The medical world doesn't really have any explanation for why this is but the brain communicates to your stomach through nerves that leave your upper back, and so if those areas are inflamed, those channels the signals are interrupted. The stomach doesn't get the information it needs and it doesn't function. It's paralyzed. Gastric paresis, stomach paralyzation.
And I remember telling someone out there, sitting is the new smoking, and they were like, "Oh, I like that. I'm going to use that." I'm like, "Wait a second. That's my chiropractor saying it's trademarked."
It's okay. No, it's okay. It's
spread the news.
very similar. Yeah, smoking. They didn't really look at it as being bad for you. It was kind of maybe it's bad for you. But people don't realize right now that sitting is deleterious to their health.
Yeah. Yeah. If the spine is your health, then it needs to be like taken care of like as divine,
As the root
early
cause.
from childhood all the way. I feel like when you're a kid and you're growing, that's the most crucial part, right?
Amen. Yeah, your developmental years, your first 26 years, but much better. Little marks, but nothing not nearly what we used to have in here. Just a tiny bit
Yeah,
here.
I was on a really good streak, but when I was out of my ecosystem / environment, I went out there and I didn't have my bed and stuff.
Gotcha. Shouldn't be any graininess.
Yeah.
Whatever you want to call.
Mhm.
Like it's kind of has a gristly, grainy feeling. It
is grainy, and you agree that if we open up the chest area, it will help the brachial plexus, right?
So the brachial plexus is underneath your pec. So as the pec is tight, it presses down on the cables that are underneath it. So the ability to irritate the brachial plexus is higher when the pec muscle is tight.
Mm-hmm.
So as we stretch the pec, then the tissue over the brachial plexus isn't able to press down on it as much, and having all this gristle and inflammation in the tissue makes the brachial plexus in close proximity to it irritated.
Yeah.
So the nerves are, if their neighbor is creating bonfires and smoke, and all the debris starts to go across to the neighbor's house. So they're in close proximity.
So I'll ask you something.
Mm-hmm.
Since, for me, in my case, my brachial plexus is being, impinged at the cervical level.
Yes.
But if the brachial plexus is getting hurt in different areas, though we reduce the areas like the chest area, does that make it less painful? Or since we still have the root cause at the neck area,
ultimately
it doesn't matter.
It's all percentages. I wish I could give to really, I need to go back and look at some imaging or MRIs, to give you a better idea on percentages. But I would say a majority of it is the neck. That doesn't mean to say that some level of inflammation is happening in the shoulder, and some level of desensitization of the nerve can happen as we make the tissue that the brachial plexus is traveling through cleaner. Real quickly on the front part of your shoulder here, a lot of acidity.
I do get a lot of pain in that front delt area.
Yeah, the nerves are having to sojourn through this tissue, and so you want to have no. That's kind of the whole kind of point of working out, is that you want to stress the tissue, you want it to microscopically tear. Yeah, not large tears, but you want to have it get torn up a little bit so that it regrows larger. It's a hypertrophy. It's all fun and games until you get your pec worked on.
Yeah. This area is worse. Oh, this side is bad.
So you're right dominant?
Yeah.
Yeah. There's more here. There's just more there than there is on the left. Yeah, that's just more. I shouldn't have said anything. I should have just left it alone. That's okay.
It's funny because 10 seconds ago, that's what my brain was like. I was having a discussion with myself. Oh man, this was a bad idea.
What?
Whoever gave me that idea was...
It's okay. I was going to find it irregardless. We were going to have to explore anyway. But
yeah, no pain, no gain. So
well, right. We gotta start processing and sifting through it all. Yeah, there's just more. Take a break. Yeah, there's a significant difference here.
I'm just wondering, maybe the left side is bad, but since the nerves have been affected for years and years because of my injury, maybe they're not as responding as this side.
There's definitely going to be a weakness. Yeah, they're going to have dysfunction. There's a lot more on your right shoulder. Just kind of double, I would say. Let me have you sit up for a little bit sitting up here. Sometimes when you're laying face down, I can't get this upper part as easy. So this is a good angle to get right there. There you go. There we go. Yeah, you touching your neck and it feeling like that's soft tissue bruising. The tissue itself needs to be cleaned out, along with, yes, underneath there's an inflamed joint. And
because I'm thinking, am I actually touching my spinal cord? I was like,
no,
that's not possible.
It's okay. Yeah, no, there's bone over top.
Yeah,
but
it's this area. Is there one spot when I just push on, it's just like a...
Yeah, it's just the nerve. It's the soft tissue that the nerve is traveling through. We want to clean out the areas above and below, clean out some of that soft tissue in the area that's inflamed. It builds up because ultimately the upper neck is a slacker. If the upper neck was working properly and if the alignment was proper, the lower neck wouldn't be in distress.
You know what? It would be awesome if they do if they're able to create, a human being that has absolutely, like a fake human being that they can just have sit down for 100 years.
Yes.
And we would see the degeneration of the spine. If he did absolutely or she did absolutely no movement.
Yeah.
So there's no movement to the spine. Is there still arthritis and degeneration? And
so degeneration is a tough word.
Imagine just sitting like this for 100 years.
Right. When there's a level of, we would say, the joints can become frozen and plaque builds up, but we don't have the ability to see that on imaging. So I would call that the problem. I'm not sure if I still would call it degeneration. It's a fixation, it's a frozenness. It's an unhealthy joint because it doesn't move anymore. But it might not necessarily become visible on imaging. What the medical and chiropractic world, when they term the word degeneration, they're referring to bone spurring, to the growth of a bone, to the disc changing from being soft and flexible to hard and crispy. So they call that degenerative disc disease. But they also call degenerative joint disease. The bone is growing if you call a joint getting bigger a disease, you have to call a muscle getting bigger a disease or a callus on your skin a disease. I disagree with the verbiage.
Yeah.
I call it regenerative joint adaptation. Joints adapt to stress and get larger. Does that make sense? It's not a degeneration. It's a tough one. So to use their nomenclature, not moving a spine would not age it. What causes what they term degeneration is abuse.
Mm-hmm.
So part of your spine is mechanically overstressed, and as a result of it becoming mechanically overstressed, it grows larger because it says, I'm doing triple the work, I have to be triple the size.
So it is trauma to the spine.
It's
The spine sitting down for 100 years will probably look okay if it's in the right alignment.
Sitting in and of itself takes us away from where we're supposed to be. So if we were standing for 100 years, but again, we're meant to move, so there'd be a lot of unhealthy things happening if we didn't.
Oh, this is for the...
Is this really a treatment?
Here we go, bud. There we go. Keeping your middle back in the game. There we go.
I'm gonna tear a hole in this so I can probably breathe. Oh, here we go.
There you go.
So,
I didn't know it was there until you touched it, Ed. I know.
yeah.
This is the secret for stopping the lower back from getting in trouble.
That's shooting up like my brain.
These are the roots of your neck. These are all the roots that need to be pushed down.
Oh. Oh.
And not nearly as squishly on this side.
Yeah.
That right one.
Seems like the right side is
Mhm.
taking over to help out with my left injury, I guess. Yeah, when we did the first adjustment and the thoracic, the mid back
Yes.
cracked.
Yes.
And my first visit, it didn't crack. So, and then you said that there's a lot of movement in the neck, a lot of movement in the low back, but the mid back's stubborn.
That's the problem.
So now that it's not, now that it's cracking, that's a good sign, right?
It's waking up. Yeah.
Yeah.
The sleeper has awakened. I am the prince of all Saiyans once again. What in the world? Sorry.
Because you want everything to move together, so.
Your middle back is the sleeper. Yeah, it's been sleeping. It's how it is.
No, that's really cool that it moves. That's great.
It was not a functional part of your team.
Yeah, because in the past I've been to many chiropractors, and that area, the mid back is.
That's your problem. Yeah. The mobility of the vertebrae prevents a lot of buildup, right? So that's the whole point. The massage and the gua sha are tools, means to an end, right? We're trying to get the vertebrae moving so that it becomes self-cleaning. Once the vertebrae are moving and you can keep them moving doing the stretching, your need for constant care goes down because essentially the tissue is going to wash itself out. You're not going to need somebody manually.
Yeah.
All that should happen as your care continues to progress, actually we shouldn't see any marks. It just becomes pink back here and we've arrived.
Yeah, and something I've been doing is like whenever I'm on my phone, I lay down on the floor on my stomach, and I just use my phone that way, versus being in bed or leaning over. So I think
really
that's
good.
really helping too.
Yeah, that's really good.
You're reducing your debts. Ultimately, the posture is determined by the rubber bands, and that's what we were getting to as we stretch your pec on the front. And as the pec gets out of the way, we'll finally get down deep enough to the rubber bands on the front
Yeah.
that are holding you forward.
Remember, I think I sent you a picture of my MRI of my mid back, and I was trying to show you how there are a few vertebrae that are kind of wedge shaped.
I remember seeing them. Yeah.
And you did say that shouldn't really be the cause of like really forward head posture. Like it could be like
Small percentage,
Small
but not a.
percentage.
I mean, I didn't see collapsed vertebrae, right?
Yeah.
So when typically osteoporotic, elderly people, they'll fracture a vertebrae and the front part collapses, and that person's then stuck forward because it's a sandwich vertebrae. I did not see that. I saw a little bit of tapering because of your, probably injuries that happened when the bone was soft, but it wasn't wedge shaped. It wasn't, severe enough that you're going to be stuck there. So the peak of your slope right now is really here, at the top, and so you're going to get the most bang for your buck right at the bottom of your shoulder blades, even more the lumbar dental, maybe the bottom of where the thoracic dental will go, and you're just trying to hit it for 20 minutes, and every time you get it to 20 minutes, you're changing your posture, millimeter by millimeter. That's the first goal. You're not going to change it if you stop at 10 minutes. You're not going to change it if you stop at 15 minutes. You got to get through the stretching of the ligament phase, which is about 19 and a half minutes into 20 minutes.
Yeah, I think for the cervical dental, I probably done maybe 10 minutes, but I haven't reached the 20. I want to try that.
We got to push to 20. It's not a made up number. It's the ligament fatigue point. This joint never has surgery. That's why it's imperative that we keep it moving to save the lower back that has all the surgery. This joint is a slacker sacroiliac joint.
Oh man.
All right, that's what we were. And it's moving much better. On your side, it was moving with a lot less reluctance than it used to.
What is that joint
That's
called?
the top of the joint, sacroiliac,
Oh man.
right there. Okay. There we go. There we go. Excellent. Good. Good. Okay. Good. How are these guys doing? No discomfort here?
I mean, I do have some like ulnar nerve entrapment on my left side, but
But on that bone right here, on the bone here?
on the right side, no.
Okay.
It's fine. I don't feel like it's just kind of mild. Oh, it did for a minute.
A little bit in there?
Yeah.
How about a Tinell's test? It's just the nerve is, I'm like that. My nerves, if you go tapping on me like that, I'll find a zinging point. I don't look at that as pathology. Some people's nerves are just a little bit more, either less insulation on them, just makes them more able for a signal to be sent. Some people have more coating on the nerve, and so or there's less insulation on it, and so it just makes it more easily excitable. I mainly care about this attachment here. So they call this the medial epicondyle, which is where your forearm muscles, the flexor muscles all attach right here.
Okay.
So, they call it epicondylitis is when that gets, so just that level of pressure usually will make somebody jump. If it's
Really?
if it's
Wow.
inflamed, this right here, the solution is to compress it back down. It'd be right here. I have a air conditioning guy working on right now, and my goodness, because he can't stop. He has to keep working, and so he picks up things all the time and up ladders holding bags and machines, and these attachments are killing him, and you got to work the muscle towards the elbow and then compress down the attachment.
Wow.
This is the
I haven't done that one yet.
kind of high value targets that I usually check.
Yeah.
Expensive areas. So
Yeah, the only thing I had was just that little bit of the ulnar nerve entrapment.
Uh-huh.
I think some bicep tendonitis years ago,
Uh-huh.
but those kind of resolved.
Looks good. I put my hand up on. There we go. And bring your elbow back into my elbow a little bit. Push your elbow back. There we go. Good. And then press back. Press back with your elbow into mine. There. Good. Okay. Tilt your head to the right a little bit to the right. Okay, it's okay. Good. Way harder than that. Tilt to the right. Okay, good. And tilt. There we go. Surprise! That one needed it.
Oh, man.
Now, if it's too difficult, you're going to put something behind your head. I don't mind if you put a book or something so you're not bending your neck too much. Now, you want a downward tissue pull. So it's made its contact. Now, you want to slide upward. So push with your feet. And see how it doesn't change its position on your skin. It just, the tissue moves.
Okay.
Does that make sense? So you make
Yeah.
your contact, and then you got a downward. My contact on my skin didn't change, but the tissue's being held downwards.
Okay.
So we call that a tissue pull. It's a downward, superior, inferior tissue pull on the tissue. So you're making your contact so you can see it. You make your contact, and then you got a downward pull.
Okay, that's step 2, right?
That's it. And
That's
you hold,
it.
and you
Okay.
hold that for 20 minutes. And then eventually these books are gone. And it's taking it at your tolerance. And then also understanding that your lower neck is apt to do the bending, even though I don't want this area that's pissed off to do the bending, right?
Right.
I want this to do it. Now, because this is relatively stiff compared to this, this area is like, I'll do it.
Okay.
Which, how do I know if that's happening? Well, if when you're doing this, you get some lower neck, the lower neck starts getting aggravated, you're gonna need to put
Right.
something behind your head.
Okay.
A little bit's okay, but if it starts getting too mad, you're gonna need to, I expect it to, and I kind of want it to be uncomfortable where it's pressing. That's a good sign that we're breaking things loose and realigning that area. It's just flexible.
You can have my claws. I want that flexibility. I want that superpower. I appreciate you, as always.
Thank you, buddy.